Right now, there are millions of people over 60 doing everything right. They take their medication. They check their blood pressure. They see a perfect number. And they feel safe. But here's the uncomfortable truth. That number might be slowly harming them. Not because they're careless. Not because their doctor is wrong. But because that perfect target was never designed for a body over 60. And the worst part? The damage is silent. It feels like nothing. Until one day, it doesn't. It doesn't feel dangerous. That's the problem. It feels like a little dizziness. When you stand up too fast, it feels like your head is slightly foggy before your first coffee. Maybe you hold the railing for just a second longer than before. So you tell yourself, this is just aging. But it's not. What's actually happening is your brain isn't getting enough blood at the exact moment it needs it most. And because the change is subtle, it hides in plain sight. Until one day, your body can't compensate anymore. So, where did this 120/80 idea come from? Most people assume it was designed for everyone, but it wasn't. That number came from studies, done mostly on people in their 40s and 50s. Younger bodies, more flexible arteries. And then, that same standard was applied to people in their 60s, 70s, even 87s, as if nothing had changed. But everything changes. Your blood vessels are not the same as they were 20 years ago. And yet, you are still being told to chase the exact same number, a number that may be perfect for a younger body, but completely wrong for yours. After 60, your arteries begin to change. Not because you failed, not because you lived wrong, but because aging changes biology. Over time, collagen builds up inside your vessel walls. Calcium slowly deposits. What used to be soft and flexible becomes stiff. Your arteries no longer behave like a flexible hose. They act more like a rigid pipe. And a rigid pipe needs more pressure to move blood through it, especially to push blood upward. From your heart to your brain, this is not a disease. It's normal aging physiology. But when you apply a low-pressure target designed for flexible arteries to a system that is now stiff, you create a mismatch your body cannot handle. And this is where things go wrong. Because most treatments focus on lowering the top number, the systolic pressure. So the medication works. The numbers improve. Everything looks good on paper. But inside your body, a different story is unfolding. Your brain may not be getting enough blood. Your heart may be undersupplied. Your kidneys may be struggling quietly. No alarms. No obvious warning signs. Just slow, silent damage. Building over time. And the most dangerous part? You think you're getting healthier when you might be moving in the wrong direction. Let me show you how this looks in real life. Margaret was 71, a retired teacher, disciplined, careful. She walked every morning, cooked her own meals, never missed an appointment. By every standard, she was doing everything right. Her blood pressure used to be around 148/84. So her doctor adjusted her medication to bring it down. 6 weeks later, her reading was 118/72. Perfect on paper. Her doctor was pleased, but Margaret wasn't. She felt foggy every morning, unsteady when she stood up. Twice, she nearly fell outside her home. She stopped going on her daily walks because she didn't trust her legs anymore. 3 doctors told her this was just aging. But it wasn't aging. It was the wrong number for the wrong body. So we tested something almost no one checks. We measured her blood pressure, lying down, then again, the moment she stood up, and the result changed everything. Her systolic pressure dropped by 24 points instantly. That's called orthostatic hypotension. Every time she stood up, her brain was briefly starved of blood, not enough to collapse, but enough to cause damage over time. And the shocking part? This test takes less than 3 minutes. Yet most patients over 60 have never had it done because no one thought to look. Now here's the concept that changes everything. It's called the J-curve effect. Most people believe the lower your blood pressure, the better. Simple, linear. But in older adults, that's not what the data shows. When scientists map risk against blood pressure, they don't see a straight line. They see a curve. Risk goes down as pressure drops from high levels. That part is true. But then, below a certain point, the curve turns upward again. Risk starts rising. That's the J. And this effect is strongest in people over 60, especially when diastolic pressure falls too low. Meaning this, there is a point where lowering your blood pressure stops helping and starts harming. Here's why that happens. Your heart doesn't receive blood when it's pumping. It receives blood when it's resting. That resting phase is called diastole. And during that moment, your coronary arteries are filled. So if your diastolic pressure drops too low, your heart muscle is undersupplied. Not enough to cause pain today, but enough to create slow, cumulative damage. Day after day, month after month, especially in older arteries that are already stiff. So while the top number improves, the bottom number may be silently putting your heart under stress. Your brain is just as vulnerable. It depends on steady, consistent blood flow. Not too high, not too low. When arteries stiffen and pressure drops too much, blood flow to small vessels becomes unstable. Over time, white matter in the brain begins to deteriorate. Processing slows down. Memory becomes less reliable. Focus weakens. And because this happens gradually, most people assume it's just aging. But a significant part of it is vascular, meaning this. Some cognitive decline is not inevitable. It's preventable if the pressure is right. Let me ask you something simple. The last time your blood pressure was checked, did your doctor measure it lying down and then again standing? Yes or no? Because for most people over 60, that answer is no. And that one missing test can completely change what your numbers actually mean. So what should your blood pressure actually be after 60? Here's the honest answer. It depends, but not in a vague way. It depends on specific factors. You can identify if you are between 60 and 75, active, independent, no history of falls, no dizziness when standing, then a target below 130/80 is supported by strong evidence. In this case, lower is protective. But if you are over 75, or if you feel dizzy when you stand up, or if you've had a fall, or notice memory changes, then the situation is different. For many people in this group, a slightly higher range, like 130 to 140, or even up to 150, may actually be safer. Not because treatment failed, but because your body needs that pressure to function properly. Before your next appointment, write these down. 3 questions. They can change everything. Question 1. Can you measure my blood pressure? Lying down and then standing? This takes 3 minutes, but reveals what sitting cannot. Question 2. What is the right blood pressure range? For my specific body, not just the general guideline, this invites personalized care. Question 3. Could my medications be causing dizziness, lightheadedness, or brain fog? Because many common drugs can contribute to this without you realizing it. 3 questions, 1 conversation, a completely different level of care. Let me leave you with this. Not everything you feel after 60 is just aging. Not the dizziness, not the fog, not the hesitation when you stand. Some of it is your body trying to tell you something is off, something fixable. Because the truth is, a meaningful part of what we call aging is actually preventable decline, caused by the wrong targets, applied to the wrong body. You are not supposed to feel like you are fading. You are not supposed to feel less steady, less sharp, less certain. And if you do, don't ignore it. Ask the questions. Get the right measurements. Have the conversation that most people never have. Because the right number is not the lowest number. It's the number that keeps your brain clear, your body steady, and your life fully yours. If this opened your eyes, share it with someone over 60. It might matter more than you think. And tell me in the comments, have you ever felt dizzy and thought it was just aging?